Hi everyone, I am Dr. Prafulla. Today we'll discuss about front of arm. The objectives of curriculum-based medical education which we are going to deal today are: describe and demonstrate the muscle groups of front of arm with emphasis on biceps brachii. Identify and describe the origin, course, relations, branches or tributaries and termination of the important vessels of arm. Identify and describe the origin, course, relations, branches and termination of important nerves of arm. So, we'll deal with this one by one. Before that, we'll do a clinical case scenario. A 50-year-old man presented with sudden onset of swelling and pain in the right arm. He was a car mechanic. During his routine work of hammering, he heard a pop sound and his right arm gave way. This was followed by intense pain, swelling and weakness in the right arm. On clinical examination, there was a swelling at his right arm. It was more prominent when he flexed his elbow. Name the structure involved, name the clinical sign. We'll discuss this at a later point of time. With this in mind, we'll proceed to today's discussion. Front of arm. Arm is the region of the upper limb between the shoulder joint and the elbow joint. Structures in the axilla, which is shown in green color here, continue down into the arm. And structures in the arm, most of them leave the arm and enter into the forearm through this yellow colored region here, which is called the cubital fossa. So, in other words, the arm communicates above with the axilla and below with the forearm. The arm itself is divided into two compartments. How? There is only one bone in the arm, which is the humerus, this bone. Now here I have shown a cross section along this line, the blue line, and the cross section is shown here. Cross section of the arm at the level of middle of the arm, where this is the bone, the circular one, the humerus. This is the skin of the arm. This blue line is the deep fascia. Between the skin and the deep fascia, this is superficial fascia. Okay. So, from outer to inwards, it is skin, superficial fascia and the deep fascia. And inside, we already know there is the bone called humerus. From the humerus on either side, extending to the deep fascia, is a fibrous structure called intermuscular septum. There are two on either side of it. There is one medially and one laterally. The medial one is called medial intermuscular septum and the lateral one is called lateral intermuscular septum. So, the humerus along with the two intermuscular septa, plural, singular is septum and the plural word is septa. Singular is septum, plural word is septa. So, one medially and one laterally. The humerus along with medial intermuscular septum and lateral intermuscular septum divides the arm into an anterior compartment and posterior compartment. Anterior compartment is functionally the flexor compartment because the structures in it flexes the elbow. So, anterior or functionally the flexor compartment and posterior and or functionally the extensor compartment. These are the two compartments of arm, out of which we will be dealing today with the anterior or the flexor compartment. So, in the limbs of the body, anywhere a compartment has some muscles, and to nourish the muscles or to give nutrition to the muscles, there is an artery, and to drain the venous blood from the compartment, a vein, and nerves which supply the muscles. So, we will deal with the muscles of the flexor compartment, the artery, vein, and nerves of flexor compartment today. Which are the muscles of front of arm, or in other words, the flexor compartment of arm? There are three muscles. They are biceps brachii, brachialis and coracobrachialis. So what is common to all these three? You can find the term brachii. Why? The term brachium means arm. Brachium means arm. So this one is a muscle of the arm which has two heads. Bi means two and seps relates to means heads. So this is the muscle of front of arm or arm with two heads. This is one head and this is the other head. This is called biceps brachii. Then the second muscle is this one called brachialis. This one, the third one, is called coracobrachialis. So why the name? This is the coracoid process of scapula. This muscle takes origin from the coracoid process of scapula. Hence the name coracobrachialis. To summarize, there are three muscles of front of arm, namely biceps brachii, brachialis and coracobrachialis. First, we'll deal with biceps brachii. So this muscle in the front of arm. In well-built individuals, you can see the two heads. One head, the other head of biceps brachii when the muscle is contracted. What is the origin of biceps brachii? We already know there are two heads. So we have to know about the two origins from where each of the head takes origin from.